Can you hear me?
Yes.
Okay, perfect. I came inside.
Okay.
I apologize about that. I was trying to do it outside because normally it works better outside, but
Oh,
I
really?
guess.
Okay.
Okay, this should be pretty like quick and simple because I saw your score on the quiz already and you got everything right.
Mhm.
We're just required to have like this final meeting, and our skill is kind of hard to like observe because it wasn't like
Yeah.
an actual hands-on skill. So
Mhm.
I was just gonna ask you like a few questions, honestly, relating to the whole like competency in general, more like just definition questions, not like super hard, but just like general, and then like application based. It shouldn't be too difficult at all. It should just be more like kind of what you learned and engage like your understanding of the whole topic in general.
Okay.
Um, we had actually a test today on the Ranchos Amigos, and like everything was
Oh,
included in our test too. And I actually found some really helpful podcasts that like break both the scales down to like understanding simpler terms and like could be beneficial to you moving forward, like just knowing the stuff for like the NBCOT and everything. So I'll pass that along to you as well. And the form that the feedback form that I'm going to fill out based on our meeting and the questions I asked, I'll fill that out and then I'll send it to you as well.
okay.
Perfect. Do you have any questions at all for me?
I did have one. It was about the difference between focal and diffuse multifocal. I like understood it the first time I went through the thing, and then I was redoing my notes and I was like, wait, I don't know if I really get the difference. Just because they both sounded really similar as far as like the direct
Mm-hmm.
contact with the head. And yeah, I guess just some clarity on that. But other than that, everything I feel like I kind of have already learned, but it was just a little bit more in depth, so it was good.
Okay. Yeah, that's good that you had learned some of it. I
Yeah.
was like, it's hard like to gauge because I got assigned a second student like halfway in because I think something with our like classes didn't align, and I felt so bad because I didn't like you didn't get to pick the skill I know, and then it was just kind of like all over the place. But the difference between you said the focal and the diffuse multifocal you're asking about.
Yes.
Okay, so the focal injury is caused by the direct blow to the head after a collision. It usually is like with an external object or a fall, or it can be like a penetrating injury as well from like a weapon or a collision with like the brain like coming forward and back.
Mhm.
Um, well, the diffuse injury occurs after like it's more of they're very similar to one another because I think sorry. Someone just came home, so I don't want to be interrupted again. I'm sorry.
Good.
Your teacher's going to be like, what the heck is wrong with this girl?
It's okay. My family's in the background talking all kinds of whatever, so.
Because they're both like one and the same essentially, but the diffuse multifocal um occurs after like a motor vehicle accident or a fall from like a higher surface. So that's how they categorize it. Like if you were to fall from like the second case in the competency talked about the guy falling from his roof.
Yeah.
So it's like the same thing occurs in the brain, but it's like how the injury occurred is what's like primary difference.
Okay.
So like diffuse multifocal is more with like after a motor vehicle accident when you're like coming to a stop and like the head is shaking, or if you're coming from like a higher surface because you're gonna like experience something a little bit like it's a little bit the brain like it's hard to explain. I'm sorry.
Yeah. No, you're.
Comes like it's like hitting off the front and the back of the head. So it's hard to explain honestly because it's like one and the same, but
Yeah.
it's just like how the injury occurred.
Okay. So they can both be like from a fall. It's just how it happens. Because I think that's where I
Yeah.
got stuff. I was like, your examples were both falling. And I was like, wait, that's not, but it makes sense now.
hmm I'm on a thing for school call. You're okay. And any other questions? Sorry if that was confusing. I can really try to explain. It's hard. It is confusing just because it's like the
Yeah.
same type of thing, but just the difference of how like the other one is more just like direct blow after like a collision,
Mhm.
um, and then the other one's more. I can understand where that's confusing. I can even like try to break it down for you right now. I'm sorry.
Yeah, I really put you on the spot, totally unintentionally.
No, you're okay. Because I was like, wait a minute. I'm like looking through my notes and like how I defined it to you guys, and I'm like, it is like one and the same.
Yeah.
But okay, sorry. Um, I'm trying to find my questions, pull them up here for you. Can you hear me okay? Okay. Sorry, I'm trying to do this on my phone and my computer at the same time, just because my um computer's like speakers are terrible. So I have like a really old Mac, and it's
Oh yeah. Oh
seen
my.
its last days, but it's gonna get me back through grad school, so that's all that matters. Okay, so I just have, I don't know if you've seen the feedback form. I'm going to flip my camera just to show you. Um, because on that first slide of the competency, I put like goals when they were like essentially like learning objectives for you. Like at the end of the competency, the learner should be able to like identify, assess, describe, and develop. And there was like a little blurb under each.
Hmm.
Um, and those are like essentially what I put. I don't use Zoom anymore either. I'm trying to figure out this thing. So those are essentially what I put on the feedback form.
Okay.
They're like the same things that on your first slide here. Sorry, it's like focusing. And then these are just like the levels that I'll rank you at based on the questions that I ask.
Okay.
So like I'm gonna ask you the few questions, and there is like unsatisfactory, which I'm not gonna rank you at that at all, especially because we've already done the quiz and like I saw that you could answer the questions, and I'm just gonna see like whether it meets expectations, which is like students meets the observable skills to pass the competency, and then there's exceeds expectations. So like if you're over the top and like explain something really well, like I'll just summarize that and score it, and like um I'll look again and I'll forward everything to you as well. Okay. Perfect. So here are the questions. Like I said, not to put you on the spot at all either. Um, it's just going to be like a brief overview of like TBI in general, and then just gauging your knowledge and everything. So if you need more time to like answer a question, or you want to look at notes or anything, just no rush at all and take your time. Okay. Okay. So the first question is, not really essentially a question. It's like, can you give me just a brief explanation or description of like what a TBI is in general?
It's basically a change in the way the brain functions, which affects entire body functions pretty much by like injury or an external force or something.
Perfect. And what are a few indicators that classify specifically what was in our competency, like a severe traumatic brain injury? Like, what classifies an individual like having a severe traumatic brain injury?
So like the symptoms, or you mean the deficits, or
Like, what deficits or what would consider it to be a severe injury?
well, their score on the, what's it called, the, I have it in my notes written down.
No, yeah, take your time.
The score on the Glasgow Coma Scale, um,
Hmm.
the LC more than 24 hours and the PTA more than 7 days.
Perfect. And then I have next question are, what were the two scales that were included in this competency?
So the Glasgow, is that how you say it? How do you, Glasgow Coma Scale
Glasgow Coma Scale, yep.
and the Rancho?
And then, yeah, the Rancho Amigos score. And when might these scales be administered to like a patient or an individual who's experienced a brain injury?
Oh, goodness. Do you do it like right away as soon as someone, or I don't know that question.
No, you're fine. Take your time.
I'm not sure. Yeah, I remember you talking about it. Um,
No, you're fine. I'll just do a little quick overview for you. The Glasgow Coma scale is the on-site scale that you're going to use like when they first experience the brain injury. It's most beneficial to be used like on site of the individual experiencing the brain injury,
mhm.
or like immediately when like at the hospital, like as soon as they get to the hospital, you want to administer that score so that you can tell like the healthcare providers and the team like where their baseline of function is at. And while the Ranchos level is a scale that they use throughout treatment. So they're using that throughout their like initial stay at the hospital, and it might be used like for a few months like during their treatment, but then it starts to phase out because this is the scale that they might come to a level where they might like plateau and they might not see any more progression. So the scale doesn't become applicable or like for use really anymore because they kind of just remain at one level.
Okay.
Okay. And so this is the next question. Why is the interdisciplinary team approach emphasized so much with TBI patients? In your opinion, why is it so important that we work as a team with all the other disciplines to care and treat for these patients?
Because like each like PT, OT, SLP, they all have something different to offer that can help a patient with a TBI improve and have better quality of life overall.
Perfect. Yeah. Great answer. Everyone working together is always what you're looking for. And you can learn a lot from other disciplines as well. Like they might see something that you might not see. So just like kind of getting a feel for what they saw or what their session might have been like, just reviewing even past notes or even talking to like nursing staff, doctors. It's always important to get the whole picture of the patient because from TBI is like it can change suddenly. Like somebody could be at one stage and then progress super like quickly. So it's important to like have that constant communication so that you can be aware of like how the patient's doing and where you might be like implementing like your approach where you can have like the most success with that patient. So it's always important, like communication is key. And the final question that kind of ties into the last like develop um, goal that was on the first slide of the competency is if you were to treat an individual with a traumatic brain injury, what might you focus on or things that like you as like personally like would go into a TBI case like looking to address?
Probably like the family support, like what the entire situation is, who their peers are that are going to support them and be there for them, whether they get discharged and are going home, and how they're going to be able to be taken care of. So just providing the family with support and resources and making them properly educated on how to help and what to do.
Perfect. That's a great answer. And that's like, was definitely one of the key components that I included in the slide. Family support is super, super big, as well as just being there for the patient as well. At first, they might not be able to like really have sort of a relationship with you, but as long as like you're as understanding with them and just letting them know that you're there to like reach whatever goals that they have in mind, or just having any sort of open communication with the patient that you're there to support them and obviously their family as well is like the biggest part of it all, and maintaining the function that they do have and building up from there. So that's always like the biggest takeaway, I would say. Um, and great job. That was all the questions and everything that I had for you. I'll send you over just via email those two podcast episodes that include like the Glasgow Como and the Rancho scales. They are really confusing. So like even I have difficulty like remembering which is like applicable to which, and they're very intense, like super, like even on my slides, I try to like dumb it down from the book into like smaller, simpler terms because you can find definitions for each level that's like so extensive and like very wordy. But these podcast episodes honestly like make it the quickest, like easiest way to remember it so that you can
Okay.
pull it into your brain and remember it easier. Because trust me, I have really like they're super extensive scales, and what's the easiest way to remember them so that you can apply it when you're out
Right.
there practicing. Okay, any other questions for me besides the fact that I was terrible answering your first question?
No, you were not. You were fine. I really put you on the spot. No, I don't think I have any other questions. It was good.
Okay, perfect. Well, I appreciate you coming with a question that put me like, no, it's good for me to think on my toes, and then I'm looking back, I'm like, wait a minute, they're like almost one and the same. But I appreciate your communication throughout the whole competency, and I hope you did learn something from the whole thing. Save the PowerPoint if you need it to reference back, but even if you just use these podcasts that I send you that are a great tool and resource for moving forward and becoming a CODA, that'd be, I'm sure, very helpful moving forward.
Well, thank you.
Yeah, you're welcome. Nice to meet you.
You too. Have a good rest of
Bye.
your day.
You too.